fibromyalgia is a very painful condition, and what you are noticing is the yoga therapy practice for fibromyalgia is the balancing poses. If you do the balancing poses, generally what we teach the fibromyalgia patient that we start with just standing, put both the feet together, and slowly get into Tadasana, mountain pose. Get the hands high up, put the whole spine straight, like we tell them to put the ear, shoulder, hips, ankle in the same line. Then we'll do, if they can do it initially is fine, if not, we'll tell them to stand on one foot. Let's get the one foot high up, try to balance yourself. Then stay there longer, about 20 seconds, 30 seconds. After they can do their eyes closed. And more they do the eyes closed, better and better. The pain relief takes place when the balance comes back. The pain also arises from, we call it a anaerobic glycolysis. It's a big term, but what does it mean? That your end product of metabolism, like food, is called glucose. Glucose combines with oxygen, forms carbon dioxide, water, and energy called ATP, adenosine triphosphate. If there is not enough oxygen, glucose has an anaerobic glycolysis. It does not burn properly. It produces lactic acid, pyruvic acid, pain-producing substance, and that is one of the big factors for fibromyalgia. So we teach the fibromyalgia patient a Bastrika Pranayama. And Bhastrika is a bellows, active inhalation, active exhalation. The way we do it in a fibromyalgia patient, we'll let them get the hands, raise their hands high up, they get a deep breath in and they breathe out, slowly pull it down. And we'll do it continuously until they have any effort in breathing. Generally, the whole pranayama practice we do in people with a disease is that as if they're doing a normal, effortless breathing. If there's any effort, we stop. And slowly, sometimes initially, I have a fibromyalgia patients, they cannot even do 30 seconds. They said, I cannot do any more. And I feel, it's okay, that's good enough. And then slowly they build up. We generally build up about 2 to 3 minutes of Bastrika Pranayama. Then we do Kapalbharti Pranayam. Kapalbharti Pranayama is very important for fibromyalgia patient because when they have a tejas, when they have a Agni, the Kapalbharti Pranayama is Agni Pradhan Pranayama. It reduces your pain. Finally, we do them, all the fibromyalgia patient, we teach them Bhramri Pranayam. Bhramri Pranayam is you cut down your 5 senses like the way we do it. If I can demonstrate one time, you'll see. I put my index finger in the forehead. I close my eyes with the 3 fingers. I close my ear with the thumb. Then I close my mouth. I breathe out first. Take a deep breath in. And we breathe out like a sound of a bee, like this. So I continue. I teach them continue. What it does, first it shuts down all the 5 senses. I close my ear, close my eyes, close my mouth. I cut down my vision, hearing, smell, taste. Then I create a vibration. So what happened, my brain is in a state of vibration and I create another vibration. 2 vibration cancels and it causes harmonic resonance. The brain or a mind totally quiets down. Pain at the moment is primarily a fibromyalgia pain. We think it is from the central in your mind and in the brain. Locally, if you have a local pain, say pain in the knee joint or pain in the hip joint, That pain is primarily from tightness, the tightness of the ligaments, tightness of the muscles. Like if you have arthritis, so knee arthritis, the bone doesn't have a pain fiber. What happens when you have arthritis, body causes splinting, called tightness of the ligaments, tightness of the muscles. There what we do, we put the leg or the joint in slowly and slowly in a relaxing position, but primarily we do the Bastrika Pranayama. Bastrika Pranayama is the treatment for pain. So coming back in fibromyalgia, balancing poses, Bastrika Pranayama, Kapalbharti Pranayama, Bhramri Pranayama. Fibromyalgia patient cannot do many yoga asana. They're so tender, so painful, you know. In fact, when you do it, I let them sit in a chair. I said, you sit down in a chair, sit down with your spine straight, tell them to sit down with the Dhyana Mudra, touch the index finger and the thumb, say close your eyes and slowly do the Bastrika Pranayama or Bhramri Pranayama. Another also we do, I say lung is like a balloon. It's had a 4-liter capacity. You are only breathing 500 cc. Learn how to breathe out longer than breathing in. And we explain to them, the breathing in is sympathetic, breathing out is parasympathetic. When you reduce the sympathetic tone, when you increase the parasympathetic tone, relaxation, the fibromyalgia pain slowly and slowly goes away. By the time we see a patient with fibromyalgia, really, when we wonder what they have, failure of pharmaceutical support. They tried everything before they come. So just tell them, only thing you need, sit down, close your eyes, and even if sometimes they cannot do a Bhramri Pranayama, so why don't you do the Ma? You know, Om sound, like Lam, Vam, Ram, Yam, Hum, Sham, Om. Ma sound, that quiets down the mind. It's called a frequency, it's called a harmonic resonance. And we have a good results. You know, we have few people who are really happy, who really can do it well, but it takes time again. You know, remember, it's a strong medicine, but it's a very slow medicine.